Dementia represents a significant global health issue, currently impacting 55 million individuals, with projections indicating that this number will nearly double every 20 years, reaching 78 million by 2030 and 139 million by 2050. Every 3 seconds, someone in the world is diagnosed with dementia. At present, 60% of those living with dementia reside in low- and middle-income countries. However, this figure is expected to increase to 71% by 2050. What exactly is dementia? It is a syndrome characterized by a decline in memory, cognitive abilities, and daily living skills, primarily associated with the aging process. Each individual experiences dementia uniquely, but generally, those affected will ultimately require assistance with all facets of daily life. The challenge lies in the fact that there is currently no cure for dementia, and individuals suffering from this condition rely on support from family members or caregivers until death. What are the causes of dementia? Numerous factors have been associated with the onset of dementia. Among the non-modifiable risk factors, age stands out as the most significant risk factor for dementia. While aging does increase the risk, it is important to note that dementia is not an inevitable aspect of aging. In addition to age, over 20 genes have been identified that influence an individual's likelihood of developing dementia. The ApoE gene remains the most prominent risk gene identified. Other genes account for less than 1% of dementia cases and are linked to young onset forms, where symptoms typically manifest before the age of 60. Women are statistically more prone to developing dementia than men, even when considering that women generally have a longer lifespan. The reasons behind this disparity remain unclear. Although we cannot alter our genetic makeup or halt the aging process, there are lifestyle changes we can implement to mitigate our risk of dementia, which are classified as modifiable risk factors. A growing body of research indicates the presence of 14 potentially modifiable risk factors. If we could effectively alter all of these risk factors, it may be possible to prevent or postpone up to 45% of dementia cases. These factors include physical inactivity, smoking, alcoholism, air pollution, head injuries, infrequent social contact, lower levels of education, obesity, hypertension, diabetes, depression, hearing impairment, untreated vision loss, and elevated LDL cholesterol. Studies reveal that a significant number of individuals currently living with dementia remain undiagnosed. In high-income nations, only 20 to 50% of dementia cases are identified and recorded in primary care settings. This treatment gap is undoubtedly much larger in low- and middle-income countries, with one study conducted in India indicating that 90% of cases go undiagnosed. If these figures are applied to other countries globally, it implies that around 3/4 of individuals with dementia have not received a diagnosis, and consequently do not have access to the treatment, care, and organized support that a formal diagnosis can facilitate. Nevertheless, early diagnosis and support can greatly enhance the quality of life for both individuals and their families affected by dementia.